I am doing a video that I don't particularly want to do, but I feel that it's highly necessary because of the lack of information that is out there for young women who deal with female cancer. There are multiple types of female cancers. The one in particular that I'm familiar with, unfortunately, is endometrial cancer, which is cancer that is found in the very inner lining of the uterus, the lining which is shed normally in a woman's menstrual cycle. First and foremost, I want young women to know that having a regular cycle every month is normal and it's vital. And if it's not happening, I want you to talk to your doctor. It may be that you skip a month or that you skip 2 months, but general consensus from my endocrinologist, from my infertility specialist, from my gynecologist, and from my gynecologic oncologist, all of which I've seen over the past 2 years, have indicated that if you're not able to have a regular menses without medical intervention, that it is important that you get medical intervention at least every 3 months to help you shed the lining of your uterus. I have polycystic ovarian syndrome, which I was diagnosed with almost 2 years ago now. That came after I consulted with my primary care physician after trying to get pregnant and not being able to conceive. She left it as it was. She then contacted an endocrinologist that I was working with already to lose weight and to balance my hormones and try to counter the effects of polycystic ovarian syndrome. PCOS is when your ovaries are not fully developed or not releasing from your ovaries and they become cysts instead. I have a lot of suspicion as to where my hormone problems came from, but since I can neither confirm that nor discount it, really it's up to speculation, so there's no point in putting it here. When I was going through treatment with my endocrinologist, I had one occurrence where I was suddenly bleeding very badly. When I say bleeding very badly, I came to work and I would have to run into the bathroom every 5 minutes because I was bleeding heavily. I was bleeding through pads. I was passing gigantic blood clots. Possibly a lot of information, and I'm sorry for that. But this is real. I left work because I bled through 2 pads and my clothing and into my seat cushion. And I left work. And I stayed home for the rest of that day. And I figured it's a really bad period. Because, I haven't had a period in 3 years. And that's really the reality. I would go 2 or 3 years without a period. I didn't know, and if a doctor had told me, and if a doctor had stopped saying that it was normal and blowing me off, because I swear to God, I've been telling doctors about problems and pain and oddities my entire adolescence, and they all said that I was crazy and I was too young to know what the fuck I was talking about. So if you're a girl and you have a problem and your doctor shuts you down, find another doctor and find another doctor. If there's something wrong and you know it, don't be as afraid as I was. Don't let people tell you that you're a hypochondriac like they did to me. Turns out I did have a problem, and that was PCOS. And if I had known how to mitigate those issues, and if I had known how to handle that situation, I might not have cancer right now. And that is the truth. So I had that bad period. It lasted a few days. I went back to work the second day because it wasn't quite as bad, and I blew it off. The second time it happened was 3 or 4 weeks later. I started bleeding rapidly. I was I was actually afraid of the blood loss. It was so much so that I was concerned about anemia. I was nauseous. I was lightheaded. If you lose too much blood, it's not good for you. So I contacted my endocrinologist's office and I said, look, this is 2 months in a row I've had this issue where I'm bleeding rapidly and I'm concerned. I said, should I talk to my primary care physician about getting on birth control to kind of mitigate this? And my endocrinologist had the knowledge to say this is not normal. And he said, before I can tell you to do anything, I need you to see a gynecologist. So he referred me to a gynecologist. When I walked in the door, she basically said, I think this is cancer. And I thought, she's rude. She's terrible. What kind of bedside manner is that? How could you incite fear in somebody like that? And sure enough, she performed what's called a D&C, which is, I believe it's dilation and curettage. I might have that last word wrong, the pronunciation. But basically, they go in, they scrape everything out, or as much out as they can. My uterine lining was 13 millimeters thick. I believe normal is like a millimeter, if that. Don't quote me on that because I'm not exactly sure. But I know that my lining was much too thick, which to me sounded reasonable because I hadn't had a period in 3 years. You know, I was so ignorant. The results of my biopsy or of the D&C were actually sent down to UCLA to confirm, because women under 60 don't usually get this cancer. That's what they say. And this is why I'm doing this video, is because there's no information out there for people my age. And I want people to share this video because I want, when young women are diagnosed with this like I was, I want them to be able to Google and find something about women their age. Because everything said 65, 55, postmenopause. Everything out there says postmenopause because this cancer, until recently, wasn't happening to people my age. Well, now it's starting to happen, and I've heard this from my infertility specialist. I've heard this from my oncologist. More and more and more, they're seeing young women who are still of childbearing age starting to come up with this cancer. So I want information to get out there to you guys. Anyways, local doctor's office diagnosed the cancer, sent it down to UCLA to a pathologist to confirm. The day that I came back into the doctor's office was, I believe, 3 weeks after my D&C, and she just got my results that day. And they both confirmed that I have uterine cancer. The only treatment for this cancer is a hysterectomy. Now, that's what's called the standard of care. I told the doctor, the gynecologist, immediately that I was not willing to do that. I am 30 years old. I don't have children. It's the only thing that I've ever asked the universe for, is to have my own children, to be a mom. So I told her I was not willing to undergo the standard of care, and she says that's fine. There are new treatments that are coming out. I'm drinking my lunch because I've been so anxious lately that my digestion has been terrible. Anyway, she sent me to an oncologist, a gynecologic oncologist. Now, these are specialists who deal with female cancers. And I have a 2-part team. And I call them Dr. Jekyll and Mr. Hyde because they're very different in their approach. One is very much, I want to follow the standard of care. I want to remove your uterus, your cervix, your ovaries, your fallopian tubes, and any lymph nodes that I feel might be affected by the cancer. This is the standard care of treatment. And this is what many oncologists across the nation are offering to young women, and they are not giving them any option. For some women, especially if there is already spread, there is no alternative. Any woman with a female cancer right now who's watching the video, I want you to understand that your specific position is not necessarily the same as mine. I had what's called FIGO stage 1, which means that the cell mutation was, I guess you could say, the least cancerous of the cancer. I don't know how else to explain that. There's levels of mutation. So FIGO stage 1 is the first stage of the cancer mutation. And so because I had an MRI done and there was no indication of the invasion of the cancer beyond the lining and into the actual uterine muscle itself, and no indication of spread to my lungs, to my pelvic cavity, to my ovaries, to any other part of my body, then my oncologist decided that I was a candidate for what's called fertility sparing treatment, which is basically hormone therapy. So they gave me a Mirena IUD. The reason being, this cancer is fed by estrogen. Estrogen can come in a lot of forms. First and foremost, as women, we produce estrogen always. If we don't have periods, like I wasn't having periods because I didn't have that spike in progesterone that was needed, without that progesterone to combat the estrogen, my estrogen levels were just always staying high. That's a symptom of polycystic ovarian syndrome. I'm also obese. I weigh 200 pounds and I'm 5'3". Extra fat deposits on your body also release more estrogen into your body. And I do believe, and now this is where speculation comes in, and I need everybody to know that this is just my belief. I believe that the amount of milk that I've always drank, I've been a fanatic of milk. I'll drink 3 glasses of milk minimum every day, and this has been for 30 years. I do believe that may have introduced some more synthetic estrogen into my body because cows are given estrogen to continue to produce milk after their calves are grown. That is only speculation. Talk to your doctor if you have any questions. No matter what, always, always, always talk to your doctors. The case is, progesterone can kind of help to combat the symptoms of the excess of estrogen. I was given a Mirena IUD. Some women are given the Mirena in combination with Megace or some other type of oral progesterone medication. Other women are only given the oral progesterone. Other women are given liquid progesterone. There are many ways to introduce the progesterone into the body to try to combat the cancer. Now, fertility sparing treatment does not work for everybody. It did not work for me. It does work for some. And the point of this video is I want women to wise up about their cycles, about what their bodies are supposed to be doing. And if you do come across this cancer, I want you to know that there are options that your doctor may not have presented to you. So please ask. Always understand that my situation is not yours. Your oncologist may have reason to believe that you have already progressed to a stage where trying hormone treatment might actually cause more harm than help. For people who are candidates, progesterone therapy, I have seen some women who, after 3 months of a Mirena, their cancer is gone. I've seen others who are on progesterone treatment for 1.5 years. In my situation, I was on hormone therapy for 9 months. All of my biopsies were coming back showing some effect of the hormone on my cancer cells. So they take a petri dish of what they've taken out and they introduce progesterone to that and they see a reaction. Well, on my most recent DNC that they did, there was no reaction this time. Because of that change in my cell mutation, and because of increasing pain, and because of my womb used to be movable, the doctor could move it around, and he can't anymore, we decided as a team that it's not safe for me to continue progesterone therapy. Now, those women who were successful with progesterone treatment, some of them have already had recurrences. Recurrence of uterine cancer with progesterone therapy is somewhere as high as, I believe I've seen, 80%. So most of the women who go through this fertility sparing treatment, they're given enough time only to attempt to achieve a pregnancy, to have a baby, and some women are then put back on progesterone treatment, and others then work with their doctor to decide when it's time to schedule a hysterectomy. Ultimately, most women with this cancer are going to get it again and are going to need a hysterectomy. That's why it is the standard of care. There is time for some people. And the reason for creating this video was because I want people to know that there are options out there. Some of you might have time. My battery's running low, so that's all I can talk about today. Please share as much as you can until a young woman my age can get on Google and find that there may be options that she can talk to her doctor about. More about me, I guess, later and what's coming. But for now, please tell young women with uterine cancer that there may, talk to your doctor, there may be options to preserve your fertility just for a little bit longer. Thank you.